Honestly and truly, I don't know that I would know whether anything had been overused or not overused.
I think there's evidence that suggests some of the diagnostic imaging and different diagnostic services, there's too much of that being done. And when we say overutilization, that's not how I think about the issue. I think about it in terms of appropriateness.
How do you explain to a patient what's appropriate and what's not appropriate? Because I know some people will think, well, it's my health, and they kind of feel it should be appropriate. This should be kind of your primary concern, is doing these tests for me.
A lot of patients come in and they're tired, and they want blood work. They don't even know what they want. They want blood work. I'm here for blood work. Oh, okay. Well, what were you thinking? I don't know. Just blood work because I'm tired. Okay. So, let's look at the things that can make you feel tired. And of course, those things are you eating properly? Are you getting enough exercise? Do you sleep at night? What's going on in your life? Are you stressed? How's your relationship? You drinking much? Are you doing any drugs? Well, people don't want to talk about that stuff. People want the blood test, right?
This is something family doctors know really well, right? So I'll give you an example. Sometimes, even on my day sheet, where I have the list of patients who are coming and the problem that they have, right? That they've told the receptionist, this is why I need to come in. It might say, needs MRI, right? So I go into that encounter. I need to understand what the problem is and what the symptoms are and where the person's starting from. And then we decide whether any investigations are needed, and if so, which is the right investigation. So as a clinician, I need to kind of back up the thought process a little bit and try to understand what the problem is.
Andy was mentioning that it might just be a matter of asking what's going on in your life. That would help with what the patient wants out of the appointment. Whether they specifically requested a test or whatever, if they just ask what's happening. Because for me personally, I've had a couple of significant life events that lead me to wanting to go to my doctor to make sure everything's okay, because the fear with my health is a lot higher than it normally is.
The patients raise so many issues, and just stuff that just go so many directions. The whole notion of worried well, right? Which is really important to this inappropriate overutilization. I mean, it's very, very hard sometimes to reassure the healthiest people. It's a dilemma, right? It's ironic.